Hello, everyone. Welcome to today's presentation. I'm super excited for you all to be here. Our presentation today is, give me one second, is a root cause approach to low energy, hormonal imbalances, and sluggish metabolism. We're going to discuss the 4-step process to reclaiming your health without pills, potions, and planks. So once again, welcome everyone. Thanks for being here today. And just a few housekeeping items I wanted to discuss. One of the first things I wanted to just remind you all of was to get the most out of today's webinar. Make sure you have your NAQ form in front of you, the root cause assessment form that was emailed to you. If you don't have it in front of you, then that's perfectly fine as well. We will be bringing up certain sections of the form as we go along with the webinar today. So if you don't have it, that's perfectly fine as well. But if you do, bring it out with you and make sure you have it by your side. And then be sure to stick around until the end for a very special offer that we'll be discussing today as well. So this webinar is for you if you are struggling with low energy, you feel physically and mentally sluggish for seemingly no good reason, you want to shed excess pounds, you are frustrated with hormonal imbalances, you have a slow metabolism, you want to put an end to yo-yo dieting, you want to reduce inflammation and pain, and if you're ready to make a shift in your health. In the next 60 minutes, you're going to learn how to accelerate healing times, how to balance blood sugars, how to sleep deeper, how to eliminate inflammation, how to supercharge your brain, how to have great digestion and elimination, how to get rid of emotional blocks, and truly how to live. So before we get started, I wanted to tell you a little bit about me. So my name is Deepa, and I'm a trained pharmacist who's also a certified functional medicine provider. This is a picture of my husband and my son as well. And I wanted to just tell you a little bit about how I got into functional and lifestyle medicine. So when I started pharmacy, working as a pharmacist, I was working in a downtown hospital in the oncology unit, and I was seeing super sick patients with complications from chemotherapy and complications of their cancer. And at the time, my husband Sachin was really getting into functional and lifestyle medicine. And I just saw a greater opportunity to really help people, especially those with chronic conditions and who were having a lot of difficulties and symptoms that were, unexplained. So I really started going down the functional medicine and lifestyle medicine path. I became a certified functional and lifestyle medicine provider. And it really served me best after I had my son. So I had a super amazing pregnancy, but I did have a few complications with my labor and delivery, and that resulted in several surgeries. And because of the principles of functional and lifestyle medicine, I was really able to bounce back from those surgeries quite quickly and really able to, be there for my newly born son. And that's why I'm so passionate about this. And so a little bit about Living Proof Institute. At the Living Proof Institute, we really believe that health begins and belongs in your home. We really believe that you are the doctor of the future, right? The doctor of the future is the patient. We really want to empower you to take ownership and responsibility over your health by teaching you skills over pills. And we also believe that your story is important. And when you become healthy, you come alive. And we also believe in paying it forward. And so this picture here shows our Living Proof clinic in Butebi, Uganda. And this is, we make a monthly contribution to this so that the members of this community are able to have accessible healthcare They also do monthly talks here to educate people on healthcare and lifestyle and the foundations of health. And so we really believe in paying it forward and serving other communities. And today I wanted to talk to you before we get started, something called normal syndrome, because I really feel like a lot of people can resonate with this. So the new normal in healthcare is when you have normal lab work, when you have low energy, when you have you might have unexplained weight gain, you might have sleep issues, you might have symptoms of anxiety or depression, brain fog and poor memory, hormonal imbalances, and lots of unanswered questions. But you really lack a clear diagnosis and treatment because your lab work comes back normal. So you're dismissed from your doctor's office and you're sent home. And so, today I know a lot of you struggle with this normal syndrome. And so that's really what we wanted to address. So today I'm going to be talking about the 4-step process in getting to the root cause of some of your health issues. And just briefly here, these are the 4 steps, and I'm going to go into them in more detail. But the first one is commitment. The second one is causes. The third one is coachability. And the fourth one is clarity. So let's start with commitment. So why commit to your health? We believe health is an act of self-love. Health is our responsibility. We have to take ownership of our health and really make the right decisions. Health is our foundation and ceiling. Health is also the trunk of our tree of life, and I'll explain more about this in the next slide. And health is really about the journey. It's not about perfection. It's about progress. So a lot of us may go all in on a certain aspect of health, like diet. We might go all in on diet, but then we don't really pay attention to the other aspects of health. And what we really want to emphasize is that we want you to make just a small shift in various areas, right? Make a small shift in your sleep. Maybe go to bed 15 minutes earlier. Make a small shift in your movement throughout the day. Maybe get outside for 5 minutes. Make a small shift in stress, right? Maybe say no to something that's not serving you anymore. So where can you make small shifts to really move your health in the right direction? Health is about daily growth. Health is way more than wealth. Health is everything. And so in this picture here, you see the trunk of the tree. And we believe that your health represents the trunk of the tree. So the branches of this tree can only grow as much as the trunk is healthy. So if the trunk is not healthy, then the branches can't grow. And in this case, the branches represent all the different aspects in your life. So if you're not feeling at your best, if you're not feeling like your health is at its best, then your relationships can only grow so much. Your career can only grow so much. So we really want to focus on the trunk and really want to focus on getting your health to its best. So why are you committed to your health? And you can type that in the chat and really let us know what your commitment to your health is. Is it because you want to have more energy to play with your children, more energy to play with your grandchildren, to advance in your career? Why are you committed to your health? So I wanted to talk today about Holly. Holly is a dedicated mom of 2 with a busy management position. She came to us struggling with difficult weight loss, brain fog, and not having enough time to prioritize her health with her family and her work obligations. She was tired of feeling like her results did not match her efforts. Holly was super frustrated, but she kept searching for an answer. She was the perfect fit for our metabolic and lifestyle reset program. Through our program, we worked on her mindset and limiting beliefs. We really engaged in a daily gratitude practice. We had frequent check-ins and accountability where she was able to submit her meal plans to me and what she was eating when she was going to bed. And that really helped her stay accountable. And through the program, Holly developed a deep appreciation for daily gratitude. Her energy and mental clarity improved significantly. She had a new blueprint for health for the entire family. So by teaching her a lot of the lifestyle principles, she was able to apply this for her entire family. Her husband even joined her on the journey and joined the program, and her kids started eating more healthy. They started all sleeping better as a family. And she got a promotion to senior manager. And as a bonus, she lost 19 pounds in 6 weeks. So this is a picture of Holly before she started with us and then after. And she sent me this message around the new year. And she said, "Hey, Deepa, happy almost New Year's to you and the family. Wishing you continued success in 2020. I also wanted to thank you and Sachin for the life-changing program, and seeing us transform over the last few months has been the best way to finish our year and be even better to ourselves and family for 2020. Thank you again, and I look forward to working together in 2020. So I really wanted to share this case with you because it really shows how her commitment paid off and how she put her health first and really made the effort to make the changes. So the second part of the process is the causes. And in this next picture here, you'll see that the root causes, so the things below the ground here, the poor diet, the toxic relationships, the sedentary lifestyle, the toxicity, the environment, poor self-image, all of these things can manifest to the top and really, really manifest into things like chronic fatigue and depression and heart disease and diabetes. So we really want to address the root cause. So some things that we want to bring to light here is that the same blood goes everywhere. And really that an upstream approach is far more cost and clinically effective. We really want to help identify problems much earlier than the traditional diagnostic criteria and imaging, and that the cause is the cure. So the form that you guys were sent can really help us identify what areas are problematic way before blood work can even catch it, right? So something like diabetes, high blood sugars doesn't just develop overnight. There's a series of signs and symptoms that occur in the body for months, sometimes years, before the high blood sugar manifests in the blood work. So we really want to go for that upstream approach, and we really want to see where these problems are starting and at what body systems they're starting in. So a not so fun fact here, to further highlight the fact that we really should look for the upstream causes is that obesity, this is a study here that shows that obesity plays a major role in triggering autoimmune diseases. So, we really want to address these things and nip them in the bud before they manifest into more serious things like autoimmune diseases. So when we look at the causes, we're looking at the story, the symptoms, and your physical presentation in your shape. So it's really important to listen to your story, because a lot of the times when we're speaking with clients, we ask them about any type of traumatic life events they may have had. And usually when we're able to highlight some of these, traumatic life events, then they can usually identify that a lot of their symptoms started after that traumatic life event, right? So you really need someone to listen to the story and help you connect the dots. And then the root cause assessment form evaluates your symptoms and really helps identifying underlying mechanisms. And also we need to pay attention to physical presentation, and we'll go into more detail about this. And labs don't always tell the story. So these are 4 very common body shapes here, and we're gonna go into each one in some more detail here. So the first one, body shape A, is associated with section 9 on the form. So this section is the adrenals. And so some signs and symptoms, I'm not gonna go through all of them here, but you may tend to be a night person. You may have difficulty falling asleep. You're a slow starter in the morning. You tend to be really keyed up and you have trouble calming down. Your blood pressure might be elevated. You get headaches after exercising. You feel wired or jittery after drinking coffee. You clench or grind your teeth. You're calm on the outside, but troubled on the inside. You perspire easily. You crave salty foods. So these are some of the symptoms associated with this adrenal body type. And some of the tips that you can start to implement if you're an adrenal body type is you really want to focus on sleep and recovery. So that should be one of your top priorities. And we'll discuss more about the sleep part of it and the rest part of it and why that's so important as well. So even going to bed 15 minutes earlier can really make a huge difference in your recovery. You really want to understand and address underlying triggers. Are there specific emotional triggers that you have? Where can you simplify your life? A lot of us lead very complicated lives. And so where can you simplify your life? Where can you learn to say no, right? That's a hard one for many of us. So where can you learn to say no? You also want to ensure adequate protein intake. And then you want to find an activity to release your stress, right? Whether that's going outside for a walk or cycling or, adult coloring, whatever it is, find an activity to release your stress. And really reducing weight and inflammation is really going to decrease the burden on the adrenal glands as well. The next one here is the thyroid body type, and that's associated with section 11 on your form. So questions 252 to 258 are associated with hyperthyroid, so high thyroid levels. So that's going to be sensitivity to iodine, difficulty gaining weight, even with a large appetite, feeling nervous and emotional, and the fact that you can't work under pressure. You may have some inward trembling. You flush easily. You have a fast pulse at rest, and you have an intolerance to high temperatures. And then 259 to 267 is associated with a low thyroid. So that's where you may have difficulty losing weight, mentally sluggish. You may feel easily fatigued and sleepy during the day. You have a sensitivity to cold and a poor circulation. You have constipation. You may have excessive hair loss and coarse hair. You have morning headaches, loss of the lateral 1/3 of your eyebrow, seasonal sadness. And this body type has an overall weight gain, right? So there's weight gain in the arms, maybe in the abdomen, and around the thighs as well. And so some tips for the thyroid body type is going to be to remove grains and dairy, especially gluten. You really want to optimize gut health, and that's going to happen by eating more of a whole food diet and removing some of those anti-inflammatory foods, and even incorporating some foods like fermented foods into your diet, like sauerkraut or things like that. And then you really want to speak up for yourself. So the thyroid is located in your throat here. And sometimes we find that a lot of women or even men who have trouble speaking up for themselves, it's almost like an energetic block here. So really want to speak up for yourself, speak your truth. You want to be involved with more joyful movement instead of super intense exercise. You want to address chronic stress. As I said, eat nutrient-rich food, anti-inflammatory foods, and reduce weight and inflammation. And then section 13 here, the next one, the next body type, which is body type B. This is the ovarian body type, which is usually classified by an excess in estrogen. So some of the symptoms here are going to be depression during periods, mood swings associated with periods. You crave chocolate around your periods. You may have breast tenderness, excessive menstrual flow. You might have some variations in your menstrual cycle, endometriosis, uterine fibroids, breast fibroids, some vaginal discharge, dryness or itchiness. Weight gain here is going to be around the hips, thighs, and butt area, excess facial or body hair. So these are some signs and symptoms of excess estrogen. And so some tips for this body type is that you want to make sure you eat lots of cruciferous vegetables. So what's a cruciferous vegetable? Things like broccoli, cauliflower, kale, arugula, Brussels sprouts. These are all foods that will help bind estrogen out of the body. You also want to eliminate plastic use and avoid toxic personal care and cleaning products. So plastics and, toxic or conventional personal care and cleaning products are filled with lots of chemicals. And these chemicals represent estrogen in the body, mimic estrogen in the body. So these chemicals are also known as xenoestrogens. And so what they do is they mimic estrogen in the body and cause estrogen, excess estrogen type of issues. So we really want to eliminate that burden from the body. We also want to maintain healthy bowel movements because estrogen is excreted through our bowel movements and eliminated through healthy bowel movements. Once again, we want to avoid BPA and we want to eat organic food because conventional food is going to be sprayed with pesticides and herbicides, which once again adds to that chemical burden in the body. And, you're getting that xenoestrogen exposure, that excess estrogen exposure. And then you also want to reduce weight and inflammation. Next, we have the liver body type. So that's body type D. So for body type D, the abdomen is more hard, and this is where weight gain occurs primarily in the abdomen. One thing about the adrenal body type, weight gain is predominantly in the abdomen as well for the adrenal body type, but for the adrenal body type, the abdomen is soft, right? Whereas for the liver body type, the abdomen is hard. So this is associated with section 2 on your form. And questions 71 to 81 are associated with gallbladder issues. So pain between shoulder blades, stomach upset by greasy foods, greasy or shiny stools, any nausea, motion sickness, history of morning sickness, light or clay colored stools, dry skin or itchy feet, headache over the eyes, and gallbladder attacks. And then 82 to 98 is more associated with liver issues. So bitter taste in the mouth, you become sick if you were to drink, you're easily intoxicated if you were to drink wine, you get easily hungover, a history of hepatitis or drug or alcohol abuse, history of prescription or recreational drug use, sensitivity to chemicals, sensitivity to tobacco smoke, and so on and so forth. You can read the rest of the signs and symptoms there. So some tips for the liver body type is that we want to reduce the burden on the liver. So reducing alcohol, avoiding toxins from perfumes, skincare, and cleaning products is really going to reduce the burden on the liver. Eat an organic whole food diet. Fasting can really help with the liver body type. Lower carb and fat intake can really help. And then reducing weight and inflammation. So if you want to type in the comments in the chat below, what's your body type? Is it A, B, C, D? And, I know sometimes people ask, well, I kind of identify with 2 of those, and that's perfectly fine. You can be 2 body types. You can be an AB body type. You can be BC. So it's very common for people to have issues in more than one body type. So if you want to type in the chat, you can go ahead. Okay. So one thing in terms of what the most effective way to balance your body type is to balance your nervous system. So I really wanted to spend a few minutes here in terms of talking to you all about this. So in this picture here, we see a part of the brain called the hypothalamus. So the hypothalamus sends a signal to the pituitary gland, which then sends a signal to your adrenal glands, your thyroid gland, and your sex organs to secrete certain hormones. And we really want to address this and make this, it's called the HPA axis, function more efficiently. And basically in our program, we give a proprietary spray, which really helps to reset this HPA axis and help it function better and help it function more efficiently so that these glands are working more efficiently and secreting the right amount of hormones. And so when we talk about the nervous system has 2 main arms. It has the sympathetic division, which is the fight or flight. And then it also has the parasympathetic division. So The fight or flight part of the sympathetic nervous system is responsible for dilating the pupil. So if you imagine a lion had walked into your room, what would happen? You'd have to dilate your pupils to see more information. So we find that people who are constantly in fight or flight and have chronic stress always need to wear sunglasses. You may also experience dry mouth because eating is not a priority when you're under chronic stress. You also might find that you have poor digestion because when you're in fight or flight and when you're predominantly in sympathetic, then blood flow is going to the arms and legs and away from the abdominal organs and the digestive organs. You also may experience bladder incontinence. You may also experience reproductive issues or infertility because when you're in fight or flight and if a lion's chasing you, these things are not a priority. You also may experience high heart rate or rapid heart rate. You have a difficulty calming down. And so this response is required for acute stressors, but really we don't want you to be in sympathetic all the time. We actually want you to be in parasympathetic for the majority of the day, because when you're in parasympathetic, that's when you're in rest, digest, repair, restore, revive, reproduce, and regenerate. So this is when you're in parasympathetic, blood flow is going to the abdominal trunk, right? Your digestion improves, your sleep improves, reproductive function improves, your blood pressure goes down, you feel more calm. So this is where we want to really shift your physiology and your nervous system, is to the parasympathetic state. And this is something that gets very commonly overlooked when addressing hormonal imbalances. And one of the tools that we give to our clients is called an inner balance heart math tool. And what this tool does is it measures something called heart rate variability and heart coherence. So on the left, you see a red wave. And as you can see, that red wave looks very erratic and it looks very abnormal. And so when you're stressed out, that's what your heart pattern is going to look like. So heart rate variability is the space in between heartbeats. And when it's erratic, it's going to show how it is in the red. When you're in a more calmed state and when you're in that parasympathetic state, you're going to be in that rest and digest state. And as you can see on the right, the green wave is much more calm. It's much more synchronistic and much more even. And that's when you're in high coherence. And that's when you're going to be in that parasympathetic state. So I'm actually a heart math certified trainer, and I help my clients shift to the parasympathetic state and become more resilient to stress, so that they're not always in that sympathetic state, because healing doesn't happen in the sympathetic state. Healing can only happen in the parasympathetic state. So some key takeaways that I've discussed so far is that we really want you to commit to your health. Have someone listen to your story, right? That's really important. Make sure you're looking for the root cause. Know your body type and the specific needs for that specific body type. And then balance your nervous system, right? Try to get into that parasympathetic state as much as you can. The third pillar I wanted to discuss was coaching and accountability. So what's the importance of coaching and accountability? Coaching really helps you to create new habits that last. It really helps you to find your blind spots. And a coach really helps to give you that positive reinforcement and helps you to stay on track. So there's something called coachability versus teachability. So teachability is your ability and openness to learn new information. And coachability is your ability to actually take that knowledge and information and put it into action. So that knowledge is only as powerful as it can be if you implement it and if you take action. And a coach really helps you to do that. So as you can see on that screen, the cell phone screen there, we use an app called Better. And through this app, clients are able to submit journal entries to me. They're able to submit their food entries to me. They're able to submit their mood, how they're feeling, their sleep, their digestive function, and also their weight to really help them stay accountable. So meet FISA. Faiza is a mother of two. She was under a lot of stress. She was a business owner. She was 25 pounds overweight and she had severe bloating. She had low energy and motivation, and she really had to push herself. She had a history of fibroids, and she wanted to make better health choices without feeling deprived. So after listening to her story, we started her on our metabolic and lifestyle reset program. We coached her on remapping her mindset towards gratitude and to connect with nature more to activate the right side of her brain and really activate that creativity, right? The right side of the brain is associated with creativity. And then gratitude and connecting with nature really helps you to shift into that parasympathetic state as well. We cut out all intense exercise. So intense exercise, it's not that it's not bad, but for healing purposes, it can really put you into that fight or flight and sympathetic state. So we really wanted to focus on recovery with her instead for the duration of the program. We put her on a strategic fasting and organic meal plan with no labs or pills. And, if you saw on the slide previous to that, she was wearing a hat and she was sweating and she was going out for runs every day and really, working hard, but she just wasn't seeing a lot of progress. And so that's why we wanted to scale back on the exercise and really focus on the parasympathetic, focus on eating real whole foods. And we did all of this with no labs or pills. And so this year was her 6-week transformation. She just did an amazing job. She looks like a completely different person, and she was just so happy with her results. So this here is a picture of her before and after. And then this was a little note that she had written to me. It says, losing phase done. I started at 151 pounds and I finished at 132 pounds. 19 pounds gone. Feeling amazing. I was at an all-time low when I started this program. The belly bloating was at an all-time high. Thank you, Sachin, for saving me that day and challenging me to push myself. So she actually is friends with Sachin, and she messaged him and was asking about the program. And, initially she's like, oh, I'll just do things myself. And then he really challenged her to push herself and to take on this program. And so she decided to do it. And so she says, I'm in deep gratitude. Thank you to lovely Deepa for being my rock during this journey. I am in deep gratitude to you. You and Sachin are really what they call the dream team. I thought that at 52 years old, I had to accept how I looked. Everyone told me it's the age thing. Metabolism slows down, don't fight it. Well, I am here to prove them all wrong. My confidence level is off the charts. So, I really wanted to bring up this case because it really highlights the fact that the coaching really helped her with the transformation, right? If she did this by herself, then, she wouldn't have gotten the accountability, she wouldn't have gotten the guidance and the strategic changes that were involved to help her get the results that she was looking for. So some key takeaways is, stay committed to your health, right? Make that your priority. Once again, be coachable and teachable, right? Remember the difference. Being teachable is being, willing to learn new information and knowledge, but being coachable is actually putting it into action. Take the path of least resistance, right? So as I mentioned before, what are small shifts that you can take that are not going to create a lot of resistance in your day-to-day life, right? If something is too hard or too challenging, it's going to be difficult. So we want you to take the path of least resistance. Know your body type and needs. So, as we discussed earlier, know your body type. Are your body type A, body type B, C, D, right? When you know your body type, when you know what your tendency is, then you know what changes you need to make, as we discussed earlier as well. And then really trust the process, right? And so lastly, the last section I wanted to talk about was clarity. So I invite you all to just take a few moments and think about why you want to be healthy. Really go back to that why. Is it to have more energy, to have an advancement in your career, to open a new business? What's your why? Why do you want to be healthy? Because when you have clarity about your why, it allows us to run in the direction of our dreams. It allows us to have more confidence in our decisions, and we're able to maybe, take on more challenges. And then having clarity means that there's no more guessing with your health. So, if you guys want to take a few moments here and write in the chat, what's your why? Why do you want to be healthy? And I'm just going to check the chat here. So what's your why? Okay, and as people are typing in, I'll move along here. So to recap, the 4-step process to getting to the root cause of your hormonal imbalance and sluggish metabolism and low energy it requires a commitment. It requires getting to the causes. It requires coachability, and it requires clarity. So I would like you to share in the chat, which area do you feel like you need the most help with? Out of those 4 areas, which area do you feel like you need the most help with? And then also, what's your biggest takeaway from today? Okay, so we had some people chime in about what their why was: to be comfortable in my body again. I'm 30 pounds overweight, hormonal imbalances. My work and purpose depends on my health. Awesome. Yeah, thank you so much for sharing. To have more energy and be comfortable in my body, to deal with inflammation. Okay, great. Thanks, guys. Thanks so much for sharing. Commitment. Okay, so someone's saying that they need more help in the commitment area. Yeah, so, these are things that it's important to identify, right? Because when we identify these things and when we become aware with these things, then we can, take action and make changes in these areas. So I wanted to thank you all for attending today's presentation. And, for those of you who wanted to stick around, I'm going to go into more detail about how you can work with us. And so one of the ways you can work with us, and, as I mentioned in a couple of the cases today, is through the Metabolic and Lifestyle Reset program. So I'm going to go into this program and what it's all about and why we created this program. So after working with thousands of patients, we noticed specific patterns. We noticed that people wanted to take fewer pills and learn more skills. We wanted to bring health into people's home to benefit the entire family. So as I discussed with Holly's case, the changes that she was making trickled down into her whole family. Her kids benefited, her husband benefited, and it just makes the whole family unit and those around you more healthy when you start making positive changes. We also believe that you are the doctor of the future, right? You have the responsibility and the ability to take ownership over your health. And we also believe that being healthy should be affordable and transferable. So what is the Metabolic and Lifestyle Reset program? It's an affordable online 10-week group-based personal transformation program. It results in mental, biological, and physical transformation. It produces safe and rapid permanent results. It addresses and corrects the underlying causes of chronic disease. And so you might be wanting to know how it's delivered. So the program includes, so all of this stuff is included in the program. It includes 3 30-minute phone or video accountability and coaching calls with myself. So we have those throughout the 10 weeks. We get 3 appointments with myself. We do a live weekly Q&A in our private Facebook group where you're able to ask me different questions about the program as they come up. And then at the end of the Q&A, I also do a heart math training to really help you get into that parasympathetic state and get more familiar with your heart math monitor. You also get the metabolic spray to balance your body type. So as we mentioned on the slide with the HPA axis. The spray really helps to balance your body type and reset the HPA axis. You get access to a 10-week online course. And in this online course, we really do a deep dive in nutrition and intermittent fasting. We talk about digestion, sleep, ways to naturally improve sleep. We talk more in depth about the nervous system and how to shift into that parasympathetic state. We go more in depth into the heart math, into mindset and stress. So we cover a lot in this 10-week online course. You also get a copy of my book, Healing Habits, where I go into more details on lifestyle principles. You get our metabolic guide and recipe book, which gives you more guidance on what type of diet to follow, what nutrition plan you're going to be implementing. And then you get a recipe book and a journal as well. That's all in one guide. And then you also get the actual heart math unit, right? So this is a $160 value. And, along with this heart math unit, you get the training, right? Because I'm a certified heart math trainer. So you get the training. You also get organic mushroom coffee or green tea. And this is a reishi infused coffee and green tea. And the benefits of reishi mushroom are so, it's just limitless. There's over 3,000 studies published on reishi mushroom. It's super anti-inflammatory. It can really help shift you into that parasympathetic state. And then it also is a powerful immune modulator as well. And then you get lifetime access and updates. So you get lifetime access to the Facebook group where I'm constantly posting new information in there. You also get lifetime access to the 10-week course. And then you also get direct access to me for 10 weeks. So through our platform here, you can message me with any questions that you have. And then you can also submit those daily journals to me on a daily basis to help you stay accountable as well. And so you get the whole program for one payment of $14.99, or we offer a 3-payment plan of only $549 on days 1, 30, and 60. And today, a special offer for you for attending the webinar. You get to schedule a complimentary 20-minute discovery call with a member of our team to review your root cause assessment form and see if the program is a good fit for you. So if you didn't have a chance to fill out the paper copy, when you schedule the discovery call, you'll get an electronic version of this form to fill out. And this phone call is really going to help us to see if you're a good fit for this program. And just a couple of things in terms of scheduling. We really want you to schedule if you're looking to make a long-term commitment to your health, if you're tired of popping pills, supplements, and shakes, if you're searching for safe, rapid, and permanent results, if you're excited to learn lifestyle skills, if you're coachable and teachable, if you're capable of making an investment in yourself, if you live in the US or Canada. So in terms of next steps, spots are limited for the discovery call. So make sure you click on the button below to schedule your consultation. So above the chat and below the screen there, you'll see a button to schedule the discovery call. Pick a time that works for you best. Complete and submit the root cause assessment form. And then we'll call you during your scheduled time. And then if you qualify, we're happy to welcome you to an awesome life-changing journey. So once again, you can click the button to schedule the discovery call. And I wanted to just end with a few comments from some people that have gone through the program. So this is a comment from one of our clients. She said that this program really works. It's actually sustained and maintained weight loss, great instruction and supervision and interaction, availability to ask questions and have them answered, interaction with other participants, never feeling alone or lost along the way, great diet and food choices. This is a total body and lifestyle reset. And then here's another one. I feel like the program has changed not just my body, which is getting better and better, but has actually changed my mind. I actually feel like I can do it. I can do this for life. I love how it addresses so much more than just food and diet. It speaks to the whole person, mind, body, heart, and spirit. I love how I feel on this program. So with that, I can take a few questions. So you can type your questions in the chat, and I'm happy to answer a few questions. I'm just going to wait for some of them to come in here. Okay, so one of the questions that came in, is there a payment plan? Yes, there is a payment plan. As I had mentioned, you can do 3 payments of $549. So there is a payment plan. Okay. Is there testing or functional lab testing? So there is no functional lab testing in this program. This program is really about making sure that you're doing the basics, making sure that you're focusing on your sleep, making sure you're focusing on your digestion. And the form really helps us to identify those areas that you need more support in. And so there's no lab testing in this program because we really want you to focus on the foundationals. And we see patients, as you can see, clients get amazing results without the lab testing. And we also wanted to make sure that it was affordable and cost effective as well. So that's why the program has no lab testing. Okay. Okay. Is there a test for leaky gut, and can that be a cause for eczema? So there is a test for leaky gut, but typically if you have a lot of digestive related issues, or skin related issues, then we can say that you might have leaky gut. But really we want to fix the cause of the leaky gut. And a lot of the times that leaky gut can be caused by stress. It can be caused by bacterial overgrowth or pathogen overgrowth. And so we really want to fix the cause of the leaky gut, because the eczema is obviously a manifestation of that. Okay. I live outside of the US and Canada. Can I do this program? So for now, just because of logistical issues, the program is for those who live in the US and Canada only. Another question, can I sign up at any time? So we're starting our next round at the beginning of July. So, that's when we're starting the program. So once you have your discovery call, then, we're going to be starting enrollments for the beginning of July. So your package will be shipped out to you as soon as you register, and then we'll get started for most people around the beginning of July. Okay, in the form, what does cuts heal slowly or scar easily mean? So when cuts heal slowly, then usually that's an indication of zinc deficiency. And so you might have a mineral or vitamin deficiencies, primarily zinc. Is there a replay of the webinar? I missed the first half. Do you explain to what conditions each of the sections on the questionnaire is referring? You will be emailed a replay of the webinar if you're registered, which I assume obviously you are. And we did cover certain sections of the form. Obviously, it is a long form, so we didn't cover all of it, but we covered some key sections of the form. So there will be a replay. So what is the total cost of the program? So the total cost of the program is $14.99 if you're going to do the one-time payment. Okay, I'll wait for a few more. Thank you again, everyone, for tuning in. I don't see any other questions. So thanks again. And it was a pleasure being with you all today. Thank you. Bye for now.